Hello and welcome back to GP Video Podcast by Nadia. So, I haven't been able to make regular video podcasts these days. Many reasons behind it. One of them is I've taken my beautiful extensions out, so I'm not very happy with how my hair look on the podcast. Anyways, I use a lot of TikTok filters as well. I'm just joking. All these things don't matter. But yes, busy. I have always been very busy, but as you know, that I've been trying to take out time for my passion all the time. But I just have been a bit slack over the last few weeks. But I am planning to get my extensions back, and that's when I will get back to doing the podcast as well. Again, as I said, no, that doesn't matter. Anyways, so the topic that I wanted to talk to you guys about today is. It's a controversial topic. Not really controversial, but controversial. It is, should you listen to your doctor or to your pharmacist? I really respect pharmacists because they are highly knowledgeable, and they have helped me a lot in my hospital career and as a GP as well, to actually rectify a lot of my mistakes, and because they know much more about medications than doctors do, because pharmacology is only one of our subjects in third year, and that's all. That's where we only learn about medications, while pharmacists actually specialize in in pharmaceutical medications. So they know all about their dosings, they know all about their indications, they know all about drug interactions, they know all about their toxicity, they know all about them much more than a doctor does. So that's what I completely relate with, and that's all I completely respect, and I always listen to them whenever they point out any mistakes or anything that they think that I haven't done appropriate. But lately, I never encountered this in my hospital life, because hospital medicine, as you know, is different, and GP practice is different. So it's going to be 2 years in March, because I started off as working as a GP in March 2023, and in March 2025 it will be 2 years that I will be working as a GP. Usually, as I said, my owner of my practice is a pharmacist. So, of course, pharmacist is our boss, and we listen to them all the time. But there has been a few instances where, I actually, as a GP, and I'm talking only about myself, I can't guarantee about other GPs, and I don't know how do they function, but I take a lot of time seeing a patient of mine. I invest a lot of time in. Every time they visit me, I just go through all the medications that they are on. I'm sure they would have seen me 2 weeks ago, and I would have given them a medication list, but I still make sure that I go through every medication, and I make sure that they are still taking it or they have stopped taking it. So every medication, then whether they are regular or they are as needed. Then after that, what dosages, and then I would make sure that they know what dosages they are taking, what is the indication of the medication. I make sure that they know what is the name of the medication, the actual name of the medication, and what is the brand name of the medication. So I make sure everything is in place. And then I also make sure that, for example, if they are on two medications, these two medications don't interact with each other, or these two, or also not only interact with each other, with every medication on their every visit, I make sure that, is it still needed or not? I know it was needed 2 weeks ago, but is it still needed for them or not? So this is how I work. And then if needed, we will prescribe another medication. So there has been instances that pharmacists have sometimes, pointed out that, like a patient of mine has gone to them and asked for a medication with a script, and they have said, oh, but you don't need to be on this medication. one of the patients actually started crying because it was, of course, a mental health medication, and the pharmacist just made this comment that I don't think you need to be on this medication. Anyways, it's very hard for patients to talk about mental health conditions, and when they start a medication or when they are doing mental health medications, anyways, they need a lot of courage to do it because it's a taboo. It's like a very unfair social taboo that we have made. So in that instance, what you should do as a patient is, if you have enough trust in your doctor, you can just, I'm not saying that don't trust the pharmacist. Trust both of them. Trust the pharmacist, trust the doctor. But do not just change your mind just because the pharmacist said that I don't think you need to be on this medication. And you just give up, and then when you go and see your GP after a month or 2 months, and then the GP is actually awaiting the results of that medication that he or she has started, and you tell them that, oh, I didn't take it because pharmacist said that I don't need it. No. There comes a demarcation, there comes a place that, doctor has invested so much time in discussing with you all your condition. Doctor has invested so much time in reviewing all your medical health conditions, and just because a pharmacist says, how does pharmacist know what are your medical conditions? Yes, pharmacist can say that the medication dosing is wrong for your weight and your height and your BMI. Pharmacist can say that this medication of yours that the doctor has prescribed interacts with another medication that you are on, anything of that sort. But the pharmacist telling you that you do not need this medication is not correct, because it is like negating the capabilities of your doctor. It is like negating your capability as a patient, that you have discussed this with the doctor and your doctor has told you everything, but you still you and the doctor together have not taken the right decision. So no. So what you do is, if the pharmacist tells you that you do not need this medication, you can just tell them that my doctor has prescribed this, and I'm very happy to go ahead with it. So if you don't mind giving me the medication out, that would be great. And then when you go back and see your doctor, or maybe make another appointment, if you have already had reservations in your mind that, oh my God, I don't know whether I need this, though you've had a big chat with your doctor before, and you've made a decision that, okay, we are gonna go. Doctor has told you about the medication, the dosage, the indications, the side effects, everything, and now just the pharmacist telling you that, oh, we don't think you need this medication, is very unfair on you, on the time that you've invested in talking to your doctor and with your doctor as well. So what you can do is, you can get the medication. If you like, you can start it, and if you don't want to start it, just make an urgent appointment with your doctor and go see her or him and just discuss this. Or if you have enough faith in your doctor, start the medication, and after 2 weeks, 3 weeks, whenever is your follow-up, go and see your doctor and tell them that the pharmacist had made such a comment, and then doctor can just tell you that this is the reason, remember we discussed this, and this is why we need it. So all the professions have their demarcations, have their boundaries. Yes, pharmacists can comment on a doctor's prescribed dosing, prescribed the side effects, contraindications, interactions with the other drugs. But a pharmacist telling you that, oh, you should not have this, or you do not need this, is not correct in my view. I'm always open to the opinions if you guys have any.